is something, don't you think, a too common a thing to talk about, and then in community medicine? Hmm. Okay. Nirav, can you tell me this? Okay, why do you think we would be or should be talking about diarrhea in our community medicine class? Mirab, are you from here in DIMC or DMC? Okay, Muhammad has replied saying that cholera is important in community medicine. Okay, why do you think cholera? मैं तो डायरिया की बात कर रही हूँ, कॉलेरा का क्या जिक्र आ गया? थोड़ा सा elaborate करोगे? मोहम्मद, diarrhea can be prevented by health measures. Okay, Moise says this.
मैम
जी शारिक?
जी मैडम, लाइक से मैडम शुरू कर दीजिए। 100 से अबव हो गए पार्टिसिपेंट्स?
जी, we have 103 now.
ओके
Okay.
मैम, शुरू कर दीजिए।
मैंने इस बारे में बात करना शुरू कर दिया तो अच्छा,
Okay,
and
ma'am.
Moise says we can stop cascade of mortality. Okay, so as we already know that, like, you know, when we're talking about, like, what is community medicine? Community medicine is basically in other countries, in some countries, it is also known as preventive medicine, yeah, or public health. So basically, any subject which is related to health and it's something that can be prevented would be talked about in community medicine. Okay, so this is the baseline. So Abdul Rauf says that diarrhea is one of the main causes of death in children. And then Muhammad says diarrhea can be prevented by water sanitation. Right. So basically, all those things, I mean, it could be any disease that we think can be prevented through measures which are nominal. For example, like, you know, whenever we're talking about mortality, it's so mortality versus the cost that is being questioned, right? So it is important that we talk about these topics in community medicine. And I'm sure you all have been talking about different diseases which are infectious. So again, diarrhea is something that is like, you know, preventable, and it is contagious. It could, like, contagious as in not by skin touch. Remember, we did it in my last class only when we were talking about epidemiology of infectious diseases, that it is important uh, that how it is transmitted, right? So in diarrhea, it could be waterborne, it could be like, you know, parasite borne, it could be due to feces, it could be due to you know, dirty hands. So again, we would count all these things as an infectious thing. So we can transfer it from one person to another. So it is important that we need to talk about its prevention and control. And you'd be surprised that it hardly costs anything. Like, you know, if we just promote it well, in the sense that if we're talking about hand washing, or if we're talking about just the replenishment of water and dehydration, to stop dehydration, it you know, is hardly any cost involved, rather than when once somebody has diarrhea and how it should be treated and the kind of antibiotics needed and the and another surprising thing you'd be surprised to know that overall uh, diarrhea has been a major killer. Well, unfortunately, these days, a major killer is our, the well-known partner, Corona, but then the SARS virus or whatever. But then, otherwise, in our uh, so-called normal days, diarrhea was one of the major killers, and especially under 5 children. WHO. I mean, the WHO, of course, sort of manages and promotes all those things which can reduce the morbidity. So they have actually introduced a workshop or a training which is called as IMNCI. Later on in years, we will discuss that in detail. So IMNCI is Integrated Management of Childhood Illnesses, in which we talk about diarrhea, we talk about pneumonia, we talk about malaria, we talk about malnutrition. So, so one of the major killers being diarrhea, we talk about diarrhea also in IMNCI. Anyways, now this is, I would say, a prelogue of the story that we're going to be talking about today. So we'll be talking about the introduction, the classification of diarrhea, the causes, and then the classification of dehydration, which is based on the IMNCI, basis. And then we have the management once it has happened, and then we will talk about prevention, that how to not get it done. Okay. If in any point in between you get a little bored, I know this topic is not too, I would say, engrossing. There's so many things that you already may know. So you can, tell me, so maybe I can make it more interesting for you guys, and otherwise, sometimes some things have to be done, even if you don't want to. So unfortunately, but I'll try to make it as interactive as it could be, with all the mics mute and whatever issues that you have, I would address them, right? So if you have any query, even if I have passed by, do type in your chat box, and then at the end of the day, I will address them. Okay. So the introduction, what is diarrhea? So diarrhea is defined as passage of unusually loose or watery stools, usually at least 3 times in 24 hours period. This is by WHO. Okay, I would tell you something. If, for example, a baby who is 1 to 2 months old or something like that, and the mother comes and tells you that बच्चे को बहुत ज़्यादा पेचिश हो रही है. Peaches is basically dysentery. Dysentery is something in which you have blood in your stools. Yeah, but then in a layperson's language, they use peaches for simple diarrhea also. So this I'm talking about rural settings now. So उसमें okay, tell me one thing. Sometimes I get urged to speak in Urdu. So are there any foreign students who would not understand Urdu at all? Please kindly type, so then I'll make sure that I do not talk in Urdu at all. Please, whoever is not conversant in Urdu or cannot understand Urdu, please let me know in the chat box. So meanwhile, you'll have to bear with me. I might be speaking English. Okay. Okay. So, for example, a mother comes up saying that my child has peaches or diarrhea, या पतले दस्त करता है. Dust is diarrhea. ठीक है. तो उस सूरत में you would have to figure out, for example, like ask her that दिन में कितनी दफा करता है. अब उसने कहा कि जी 3 दफा करता है. So 3 दफा is pretty normal, right? For a child, for a baby who's 1 to 2 months old. But if she tells you कि जी सुबह से कुछ भी खाता है और इसको दस्त शुरू हो जाते हैं, या कुछ भी पीता है तो उसे दस्त शुरू हो जाते हैं, तो उस सूरत में, in that case, you would know that the diarrhea is actually prevalent or actually occurring, rather than If somebody who has a pattern of going to the toilet or is normally defecating 5 times a day. So, so you will have to figure out whether it is diarrhea or it is just the norm of that, like the bowel habit is of normal frequency. Okay, so and then you would have to figure out, however, it is the consistency of the stools rather than the number that is important. As I said, that if it is really watery and whatever the patient or the child is having or the person is having, and then he's having loose motions, so that would definitely signify that it is diarrhea. So passage of even one large watery stool in young children can be diarrhea. So frequent passage of normal stool is no diarrhea, as I explained earlier. So it is not the number; it is ideally the consistency. But then again, if somebody as a norm has been all his life been going to the loo for 5 times a day, then I don't think that's diarrhea. Okay? Okay. So here it is 6 to 12 months of age are affected severely and account for high mortality. The reason being, can anybody just type in just maybe 100th of a second that why do you think a small child is affected more, and especially 6 to 12 months? Why the high mortality? Why? Okay, I have some answers. Dehydration, because the intestinal flora is not present, gets dehydrated really quickly, electrolyte imbalance, body mass is less, so fluid loss will quickly lead to dehydration. Right. Somebody who's older would probably say, मुझे प्यास लगी है, मुझे पानी पीना है, would just go and get water for themselves, right? But a child who is 6 to 12 months old, one thing, he is not capable of going and getting water for himself or any fluid for himself. Right? The other thing, if he is sort of defecating watery stools, so the replenishment of the dehydration has to be equally faster, right? So, it is recommended that every time a child passes stool, you are supposed to, 6 to 12 months, you're supposed to definitely give about 5 to 10 spoonfuls of water, yeah, or ORS or whatever. Okay, so you see, it is important that the replenishment is done faster. So what you do whenever you know the amount that has been defecated, that has been passed in the stool, the water. So try to replenish that double the amount that has been lost. Okay, so dehydration. Here it says dehydration occurs when water and salts are not replaced adequately and may lead to shock and death. Diarrhea also produces undernutrition and growth failure. Because you see, at this point, if we're talking about young age, 6 to 12 months, or younger, or a little older, or within 5 years of age, the child generally 6 to 12 months is just on the breastfeeding. So the water content, the nutrients it's getting from the milk, right? So if that is not being absorbed, it is just going in the body and being washed out of the body. So it is not being absorbed. So then it means that it is going to cause undernutrition also. And if it is going to cause undernutrition, it is going to affect the growth, right? So it is very important. Okay, diarrheal disease constitutes one of the important nutritional needs in young children. Even a brief episode of diarrhea leads to loss of 1 to 2% of body weight in children, right? Here I have focused more on the children because generally we are really concerned about the diarrhea in small children, and especially under 5. But of course, these things can be very, very morbidity causing or mortality causing in older people also. Uh, so it says it is the second leading cause of death in children under 5 years globally. Globally, there are about 2 billion cases of diarrheal disease every year. Diarrheal disease kills about 1.5 million children every year. Africa and Southeast Asian regions, unfortunately, our region comes in where together account for about 78% of them. India alone contributes to 20% of all global under 5 diarrheal deaths. And the sad part, or I would say the progressive part, if we can do something about it, is preventable and treatable. It, we need to work on something that it should not happen. If God forbid, if it does happen, it is treatable. Okay, I have some. Ma'am, your voice is low. Okay, can you hear me now? Is it better? Yeah, can you please type? So let me know. Is it better? Okay, great. Great. Thank you, Rida. Okay. So, great. I think probably I had put down the mic, so that is fine. Okay. This is a graph which tells us that what are the reasons of death in children, right? But you see here, 14% deaths are due to pneumonia, and 14% is a big number. I mean, if you just come to think of it, if you say, oh, 14% तो हैं, 14% ही तो है, but 14% are those children who could have been prevented of death, who could have been taken care of, who could have been treated. So why? And you know what happens when we have this 14% death? So it is going to contribute to the whole overall mortality rate of children, and then mortality rate of the community, of the country, of the region, of the world. You get it? So the chunk is coming from that bit, 14% diarrhea. But then it is sort of accumulating overall. So the mortality rate, it adds on to the mortality rate, global mortality rate. So we need to talk about it. We have to talk about it. Okay. I'm sure, medicine people would have talked about the classifications and all. So I would just go skim through it. If there's anything in detail that you're not understanding, let me know. Otherwise, I think this part I would not focus too much on. Okay. Acute watery diarrhea. Then we have the dysentery, that is with the blood in the so the intestinal lining is being affected. Yeah. And then we have the persistent diarrhea. Anything that is above, occurs above 14 days. I'm sorry, 14 days. So it's going to be called persistent diarrhea. Could you just hold on and make it a little light? Okay. So when we're talking about acute diarrhea, it starts suddenly. Most episodes recover on self-limiting within 3 to 7 days and may last up to 14 days. We get till 14 days, it could be acute watery diarrhea. But then 75% of all the episodes are of acute watery diarrhea. So acute watery diarrhea is big in number, but then it could be corrected easily. Okay. Then we have diarrhea with visible blood or mucus in the feces, abdominal cramps. It has to be generally dysentery. It has to have a bacterial background or a viral background, or although acute watery diarrhea would have something, would have that run too. But then dysentery is sort of affecting the wall lining of the intestines also. This is just that it is not being absorbed and it is being rushed through the bowel, and this is that it is affecting the lumen and the walls of the intestines also. Okay. And then we have the persistent diarrhea, anything which lasts more than 14 days. Incidence is around 5%, that is 5% of acute diarrhea may persist beyond 2 weeks. So if we are not going to treat the acute diarrhea, it is going to convert into persistent diarrhea. And you see here, 75% of the episodes are acute diarrhea. So, unfortunately, if 50% also do not get treated, so it is going to be converted to the persistent diarrhea. And if it gets converted to persistent diarrhea, of course, it is going to produce more disability in the community. Yeah. So we have to be very careful. Again, I will not focus too much on the organisms because it's something you will do in pathology, you will do in different other subjects, medicine, we talk about it. But I have just jotted them down here for you guys. The bacteria which affects the intestines and causes, as one of the students right in the beginning talked about cholera. And then we have typhoid, and then we have different, Shigella and all these. Okay. Then we have the viruses, out of which it's one third of the total causes. So we have different rotavirus, and rotavirus is one of the commonest. And then we had, unfortunately, we have never heard of coronavirus. Well, not generally before 2019 December, but it was existent. It has been been a boom after. Well, I don't know whether I should be giving this opinion of mine, but I personally feel it is it started with terrorism and bio war kind of a thing. But then, so that means it was existent, but it was within control. It was not something. So they have whoever, I would not talk about who did it, but whoever sort of mutated the virus and sort of instigated and introduced it into our lives, right? So it was existent. And unfortunately, very surprisingly, now there's so many other presentations of coronavirus and COVID-19. So diarrhea is one of them. Diarrhea is one of the presentations of corona virus disease. Okay, so rotavirus causes 10 to 15 to 25% diarrhea cases in developing countries. Anything, guys? If you want, please type in your chat box. I would respond because I do not like participants or people just lying there. So if there's anything that you are not understanding, please. Okay, then very important type which occurs the diarrhea are the parasites. Okay, well I'll show a very interesting video right at the end showing us the worm infestation which causes diarrhea, right? Okay, so the signs and symptoms of dehydration. Just emphasizing on child's age more, child's health more, because as we've talked about that in 14% of children die of diarrhea. So this is something of concern. We talk about polio very highly because it is unfortunately getting good funding from abroad, but diarrhea is not getting funding as much attention, so we do not talk about it. But then unfortunately when we talk about that 14% of the children die of diarrhea, so we need to focus on saying that we need to address this fact. Okay, and why I'm focusing on children? Because they die in just a jiffy. I've seen patients coming in, the mothers not realizing, not being aware how and what has happened to the child, and all of a sudden when they bring in the child, so it is already too late. The child has dehydrated so badly that he cannot survive. So it's very important. So the approximate amount of ORS required in ml can be calculated by multiplying the child's weight in kg times 75, and whatever the milliliter comes in, we need to replenish that kind of that amount of fluid in the body. Okay. For infants who are not breastfed, also give 100 to 200 ml of clean water during this period. The breast milk and water will help prevent hypernatremia in infants. So make sure whenever you in your life do clinics and in the medicine department, make sure do emphasize on breast milk. Never ever stop breast milk, and it has been seen, it has been proven that all those children who have had their mother's breast milk have have better immunity to combat diseases, right? And diarrhea is part of it. Okay. Now, but one thing very important when we're in a rural setting, especially when we think that the awareness of the mother is not so good. I mean, WHO has done a good job by instigating that ORS usage is important in all those areas, on all the rural areas, that ORS should be given. But then how much should be given is not so much being advocated. So it's important that we should, train the mother the right way, that how it should be, given. So we need to reassess the child, classify the child of dehydration, what kind of dehydration. I've just been telling you how we classify dehydration. And then we select the appropriate plan to continue the treatment. That is, we will calculate how much water content is required, and then begin feeding the child in the clinic right in front of your eyes. I mean, if some child comes to you with diarrhea, you need to sort of train the mother right in front of you so that she knows what needs to be done. Okay, so these are the signs of dehydration. The child, you will have sunken fontanelle, reduced level of consciousness. Again, reduced level of consciousness is one of the last that you sort of see, right? The child will be irritable. At the end of the day, maybe the child is tachypnea. He may not be micturating well. The mother would complain that he has lost weight. It is not initially. It is not the weight that he's lost. It is the water content that he has lost. Okay. The eyes would be sunken. Even if he is irritable, he would not cry. And then we have the one of the major indicators that we see the tissue turgor. We pinch the child's tummy or this area where there is muscle mass, right? And then we sort of hold it and then let it go. If it goes back right away, so that means that he does not have dehydration. But if it you would actually experience once the or maybe you can look on YouTube say signs of dehydration, and then you talk about the reduced tissue turgor. They will show you that if you just leave it, sometimes it takes about 2 to 3 seconds or maybe 20 seconds. So it depends how the skin is going back to normal, would tell you that it is how severe the dehydration is. Okay. Okay. In early stages of diarrhea, when ORS packets are not immediately available, HAF is given and continue feeding. We need to not stop breastfeeding. And one other thing, that misconcept that we have, even when the child is big enough, or he will could you just hold on? Okay. And then thank you. Okay. Then we would make sure it's a misconcept that uh, a misconcept that when you have diarrhea, you should stop feeding the child. That's now not how it should be. If you are not supposed to totally not give food. If you're talking about small children, of course, breastfeeding is the only thing that is needed. But if you're talking about older children, you could be giving them smaller meals or some porridge or some food that is, very mild and soft. But of course, you need to avoid the naharis and the biryanis and all that. Um, okay. Uh, then you're not supposed to give too much of muraghan ghazayan like chicken and beef or whatever. But then you can be giving them milder food. And what is very important that you should not be giving soft drinks or sweetened or foods or and it's a norm that we give tea to children and all that. So that is also should be avoided because these have high osmolarity and can lead to worsening of diarrhea and therefore lead to dehydration. Prevention is very simple. सबसे important sanitation. You have to be clean. Clean water is important. Hand washing is important. I mean, this is what I've been blabbering about right from the beginning. That if you look at the disease cost or disease treatment cost versus the prevention is something that you should be doing anyways, right? Breastfeeding, proper nutrition, vaccination would build your immunity against different diseases, so it would help. Then of course being neat and clean, what's the harm? Then the clean water that we should be having for drinking, for washing and whatever, right? And then the hand washing. All these things are very, very important. Um, Yeah, you had a query that what is HAF? It is that all those fluids that you can have from home. I mean, if you do not have water, if you do not have ORS, you can simply replenish by putting a pinch of salt and a teaspoon of sugar in the glass or some lemon in it, and that would help. Okay. Uh, Well, thank you, but I have a video for you guys I would want you to see. So just hold on for a second. Meanwhile, if you guys have any, queries, please feel free.
Yes, ma'am. Assalamu alaikum.
वालेकुम सलाम.
जी मैडम, लेक्चर एंड कर
हाँ नहीं शारिक, मैं ये एक इनको वीडियो दिखा रही हूँ.
ओके मैम.
Okay. Can you guys see the screen? शारिक नजर आ रही है?
यस मैडम. जी मैडम, स्क्रीन आ रही है आपको नजर? काइंडली प्ले कीजिए.
We are talking about worm infestation. Just hold. Okay. अच्छा, आवाज मुझे बताना शारिक कि सही से प्ले हो रही है आवाज?
ओके मैडम.
आ रही है आवाज?
यस मैडम, आवाज आ रही है वीडियो की.
Great. So guys, please see this video very attentively.
Like the name suggests, soil-transmitted helminths are a group of parasitic worms or helminths soil that's been contaminated with their eggs. These infections are very common. It mainly affects poor and disadvantaged communities around the world. It's estimated that over 1.5 billion people in the world are infected with these worms. That's almost a quarter of the world.
आवाज साफ आ रही है?
जी मैडम, आवाज आ रही है बिल्कुल सही।
Population. Most of these infections occur in tropical and subtropical countries. They're commonly seen in areas where there's warm and moist climate and there's poor sanitation and hygiene. Although there are many different species of helminths, we'll focus on the three main types that cause infections in humans. These are roundworms, Ascaris lumbricoides, whipworms, Trichurias trichuria, and hookworms, Decatur americanus and Ancylostoma duodenale. They vary in the type of illness they cause and their life cycle. Soil-transmitted helminths are transmitted by eggs that are passed in the feces of people who are infected. The soil can be contaminated by feces in areas where there's poor sanitation and people defecate outside, or when human feces is used as fertilizer. Once they're in the soil, roundworm and whipworm eggs mature into an infective form. This can take a few weeks. Hookworm eggs, on the other hand, mature and hatch into larvae that have the ability to penetrate skin. A person can be infected in several different ways. It can enter through the mouth. This can happen when foods such as vegetables are contaminated with eggs and are not cooked or washed before eating, when water is contaminated, when people's hands are contaminated by the soil and not washed before eating. Hookworm larvae have the ability to penetrate the skin of people. People usually get infected when they're walking barefoot. Very rarely, some types of hookworm larvae can get into the body when they're consumed. Now, once they enter the body, they eventually make their way to the small or large intestine, where they live and grow. But they have slightly different ways of getting there. Hookworm larvae that penetrate the skin are carried through the blood into the heart and lungs and eventually make their way to the small intestine. Roundworm eggs that are swallowed hatch into larvae, enter the blood, make a trip via the heart and lungs, and eventually make their way to the small intestine. Whipworm eggs, on the other hand, hatch into larvae and make their way directly to the large intestine. Once in their final destinations, they attach to the wall of the intestine, grow, mature, and can live there for many years. They also produce thousands of eggs per day, which are then passed out in the feces to start the cycle of infection again. People can be infected with more than one type of worm at the same time. So, how does this disease present? Well, the symptoms will depend on the type of worm and the number of worms that are living in the intestine. People with very few worms may have no symptoms at all. On the other hand, people with a lot of worms can have a range of symptoms. What happens in the intestine is that these worms can feed on tissues, blood, or nutrients. There can also be blood loss and inflammation at the sites where the worms attach. The chronic blood loss leads to anemia. The loss of protein and reduced absorption of nutrients can lead to nutritional impairment and malnutrition. When these happen over a long period of time, it can lead to impaired physical and mental development, especially in children. This can in turn lead to poor school performance and reduce future economic productivity. Other symptoms include diarrhea and abdominal pain, malaise, weakness, and loss of appetite. With hookworm infections, there could be skin irritation where the hookworm larvae enter the body. And sometimes, people present with respiratory symptoms when the worms travel through the lungs. Heavy infections can lead to bowel obstruction, which can be life-threatening. Whipworm infections can lead to rectal prolapse. Sometimes the worms can migrate and cause disease in other parts of the body, like the bile ducts and nasal sinuses. Infections are usually diagnosed by looking at stool samples under the microscope and identifying eggs. Sometimes worms can be passed in feces and are large enough to be seen. Worms such as Ascaris can grow up to 35 centimeters long. So how do we treat these infections? There is very effective anti-helminthic medication to treat infections. When there's bowel obstruction or prolapse, surgery is sometimes needed. Let's talk about prevention. Over the years, there have been sustained control programs that have been led by the World Health Organization, national governments, and with the help of others such as non-governmental organizations and pharmaceutical companies. The best long-term strategies to prevent soil-transmitted helminth infections are having clean and uncontaminated water supplies and improving sanitation, such as providing appropriate toilets and effective sewage disposal systems. Hygiene practices such as hand washing, washing food, and not walking barefoot will also prevent people from being infected. In parts of the world where there are difficulties in implementing effective and large-scale improvements in water and sanitation, periodic mass drug administration, also called deworming, for at-risk people has been very effective. This can reduce the burden of disease and subsequently the consequence of infections. At-risk people include preschool and school-aged children and women of childbearing age. People in certain jobs such as tea pickers or miners are also at high risk of infection. Deworming is usually done once or twice a year, depending on how common the disease is in those communities. Although there's research into developing a human vaccine, there is no effective vaccine on the market yet. And that's a quick look at soil-transmitted helminths. For more information, have a look at the websites below.
Okay. There are a few things in the chat box, so let me talk about them. But then you need to give me feedback about this worm infestation lecture, the video. I could have done it myself, but the point is, it would have been too monotonous and too boring, so that is why I got hold of this video. I would like to share some pictures. If you let me just open my camera. Okay. Can you guys see this? Okay. See, this is these are the worms. Or if you just Google, you'd see worms and feces. So you see, they could be very, very long in your feces. And then we have another picture. The guy talked about the worms coming out of the nasal or the oral cavity. Yeah, so if, of course, alhamdulillah, I mean, when we're talking about, urban societies or where we are living, we do not have overall, these issues. But then this, as you can see, was an African boy who has been, maybe he does not have some footwear, and he is going to be going around in the farms or whatever. So these worms can penetrate through your feet also. Okay, now it says how much time we should give ORS on one day and ml. See, I told you that body weight times 75 would be the calculated amount of ORS in 24 hours. God forbid, if there's any heart issue, then we should be scared of giving too much water and avoiding the overload. But other than that, Hamad, please switch off your camera. Other than that, it is not unrecommended. You can give as much fluid as you can. ORS is also salt and sugar solution, so will it not have high osmolarity and worsen the diarrhea as well? So you see, there is a particular amount of salt and sugar that is added in the ORS that is required to maintain the normal pH and normal body percentage of because if you I'm sure we all know the biochemistry and the the working that a body has, the osmosis and the diffusion processes. So for that we need some kind of sodium in our body and some kind of potassium in our body. So and glucose is needed for the energy. So a minute amount is required, but the kind of of overload that you would have in the cold drinks, or the sugar content in the juices. I mean, even if it is a fruit, a fresh juice, then we have a lot of fiber in it. So that is also not good for the tummy at the moment when there is diarrhea ongoing. Yeah. So a particular amount of salt and sugar is acceptable. Okay, then why are women of childbearing age at risk? See, overall, women in childbearing age are a vulnerable population. Unfortunately, if we're talking about rural, or if we're talking about some of the even urban societies, do not give that kind of an importance to females. Unfortunately, it's a cultural thing that लड़के को दो निवाले और लड़की को एक निवाला. So she's already malnutritioned, and she's her immunity levels are low. And please do not think that oh madam किस किस्म की बात करी है. Why I'm saying this? Because alhamdulillah, we all, you, me, and all those who are in this class belong to the privileged class, alhamdulillah. So we cannot even imagine the kind of torture a female can go. And boys, do not think that I'm talking about just I'm not a feminist. I do not believe in that kind of a thought process. But then it is unfortunately a thing which is happening around us. So we have to talk about it, right? Is ORS contraindicated in hypertension? Hamza, it is not contraindicated, but too much of ORS also is not indicated. So in the beginning, to replenish the water content, you can give ORS, but then nothing like simple water. Yeah, but then you should be giving some semi-solids or semi-fluids, gulatti ho gayi, porridge ho gaya, इस type की चीजें for those people. How fast does the hookworm larva penetrate the skin? If you're walking barefoot on the grass and wash our feet later, we're safe, or is it still risky? Well, it depends. How fast? I mean, it is not going to be like in a jiffy that it is going to shroot karke andar ghus gaya. Aisa nahi hota. Yes, and you're right. The prevention is that if you walk in grass, I tell you one thing. Generally, they do not exist in an urban setting. Hame, us being here in a city, in a metropolitan city, the grass does not have these kind of worms. They can, I mean, in the sense that the cycle is through your the animal, or maybe some dog has those hookworms and he sort of defecates and all that. But yes, if you wash your feet, it is not going to be that bad. It's not like a minute, second mein you have it, kind of a thing. Yeah. So, any more questions? I hope it was a good lecture. I hope you've understood. If there's any feedback that you want to give, is there anything that you think I should be doing to make my lecture better, please go ahead. You all have my email address. Please kindly, one of you, whoever the CR is or whatever, can please email me reminding me that I've shared the lecture with you. And anyways, it is going to be uploaded on your LMS also. Okay, what does it say? In person, unaware when the worm is penetrating the skin. Is a person unaware when the worm is penetrating? Yeah, it could be, because it's not only the worm that is penetrating. Sometimes you have a wound there and the egg gets implanted there. Yeah, and then if it gets implanted and then it is absorbed in, and then it sort of replenishes and grows. Yeah. Okay, Moise, thank you so much, Moise. I've read a case in which an egg penetrated blood-brain barrier and started growing on brain. Is that possible? Yes, it is, Hamza. It is possible. Yeah. Okay, so is there anything else or we should call it a day? Please email me just to remind me so I know I can send it. And I hope you all have my last lecture also, because I did pass it to one of your colleagues who said who's the CR of the class or whatever. So please, DMC and DIMC, if there's anything that you want, please email me. You said when you say, ma'am, can we give commercial juices like ruafza in diarrhea? Ideally not, Moise, because this is what I said. The sugar content that ruafza would have. I mean, I'm not saying do not, but I'm saying ideally not. You see, do you know the difference? I mean, ideally ORS is good, or simple water is good, or simple fresh lemon would be good. You know, anything that is fresh. Orange juice would be good, but then orange juice would have a lot of fiber, so probably avoid that in the beginning when you're having a large number of like, you know, fluidy stools or whatever. But see, ruafza, chai, quiz or whatever, you know, all these things are all essence and chemicalized things, and then you have lots and lots of sugar contents, so it's not good. No, ideally not. You said something about bioterrorism and COVID-19. Would you like to know about it? Ayman, basically, see, I told you, I don't know if whether I should be talking about this here or not, but then, you know, it's something in the air, and then they're talking about saying that COVID is something like, you know, coronavirus was existent before this pandemic spread. Okay? So it was there, but it wasn't causing such kind of deaths. So it has to be something like, you know, some kind of a theory should exist. This is my opinion. I am not sure. I did read a few research articles, but then I cannot quote them here because in the sense I don't remember which reference or whatever. But then you can read about it and maybe find out. But you know, like sometimes your mind needs to do 2 + 2 kind of a thing, that it has spread and whatever. There were SARS and MERS by coronavirus epidemics few decades back. Yes, Maze, they were there. And then, you know, the mutation also is there. So mutation might have occurred. But again, I'm not sure myself. It's just was a, I should say, a loose ball that I threw. You know, that it seems that it's something like bioterrorism, but then at the end of the day, we all have faith. God is there, so it could be just like, you know, a natural mutation that occurred. That's all that I have to say, Eamon, about it. And rest you will have to read, and maybe if you read, maybe we can do some research about it together. Yeah. Okay. So 4 minutes to go. Anything else, or we can call it a day? Thank you, Eamon. I appreciate feedbacks from my students if there's anything that is lacking, especially. I mean, I don't mind, and I like, you know, really appreciate your all my students' insights. I believe I learn a lot from you all. You know, it is really nice to get feedbacks from you people, so that I can make my teaching, my facilitation better. Is that's a little a tough thing to get myself into DMC. to go. Whenever the posting comes, yes, I'm going to be there for you, and I'm here anyways. Even if I don't come, whenever I'm always open. You can contact me. I have no issues to that. I know, Hayaka. Same here. But inshallah, the time will come. Don't worry. Okay, I'm glad, Rida. Everybody likes it, but need more feedbacks. We can, like, make ourselves always. There's always room for betterment. Okay, guys, take care. Allah Hafiz. Sharik.